We have with us on the line to discuss more on the influenza outbreak is Doctor Kow Ken Siong, who is a respiratory specialist from Sunway Medical Centre. Hi, Doctor. Thanks for joining us tonight.
Hi, Miss Aslina.
Hi. Yes. So, okay.
Thank you for inviting me. Yeah.
It's a pleasure. Thank you for joining us. Now, talking about the influenza outbreak, is this rise normal, especially during the season? And if so, what do you think are the factors contributing to this outbreak?
Okay. Now, we are indeed seeing an increase in the number of influenza cases this year compared to 2018 and the year before. But I would say that this is not exceptional. We tend to forget that influenza is a very common disease and is frequently occurring throughout the year. So this is hardly an exceptional year. Now, one of the factors that's contributing to an increase in the number of influenza cases this year I would think, be due to the prolonged wet and rainy weather. Now, we have to remind everyone that influenza is present throughout the year in tropical countries like Malaysia and tends to peak during the rainy season. Now, the reason we are seeing this increase in the number of influenza cases now is because of the prolonged rainy season.
Okay, so Doctor, basically, right now, we're focused a lot on the school students, and with the school just opening, and it's a very isolated situation where it involves a lot of school students at the moment. But who else do you think is most at risk from the virus, and what precautions and advice would be taken in order to prevent this outbreak from getting worse, Doctor?
Okay. Now, influenza is transmissible from aerosol droplets from one person to the other and is considered highly transmissible. So first and foremost, the people that are most at risk of influenza is pregnant mothers, okay, because they tend to get a more severe influenza disease during pregnancy. Other groups that are at risk of influenza include individuals who are considered elderly. So this would be people above the age of 65, and of course, young children less than 5 years of age. Finally, I would also like to point out that individuals of any age with concomitant illnesses, for example, if they have chronic lung diseases, if they smoke, if they have heart disease, if they have kidney disease, or are otherwise immunocompromised for various reasons, they tend to be at risk of more severe influenza. Now, there are several means of protecting ourselves if we are at risk of severe influenza by taking several precautions. So first and foremost, get the influenza vaccine because it has been shown to reduce the severity of influenza disease in individuals who are at risk. Of course, practicing certain hygiene is important. For example, cough etiquette. If you cough, try to cough into a tissue or a handkerchief to prevent the spread of disease to other people. Of course, wash your hands regularly. If you are particularly at risk of getting influenza, try to avoid going to overcrowded places because of the nature of influenza, which is highly transmissible. If you are in an overcrowded place, you could actually get influenza very easily. So if you can't avoid such scenario, do wear an N95 mask. Yes.
Okay, thank you. Thank you so much, Dr. Kow, for those insights. And that was Dr. Kow Ken Siong, who is a respiratory specialist from Sunway Medical Centre, who joined us on the